Living without a toilet facility at home can be a harrowing experience for anyone. 15-year-old girl who suffered and later recovered from clutches of typhoid fever, Abena, narrates her ordeal during a visit to her home.
I got to know I had typhoid fever because I had the symptoms, vomiting, defecating around, and feeling dizzy. So I was rushed to the St. Martin's Hospital before we identified the disease that is affecting me. It affected me in so many ways, such as my education. I missed classes. I couldn't write some of my mock exams ahead of the BEC, and it also affected me in my BEC.
And for that matter, she's not been coming to classes. As a result, it affected her because it even skipped one of his mock subjects. It skipped her. So it has affected her seriously. So we are only hoping that he will do well in the exams.
It also affected my friendship. People didn't want to come close to me. I couldn't get close to people because they noticed that typhoid fever is a transmitted disease. So people were afraid to get close to me.
I was really worried because I'm a single mother with 4 kids. For the other 3, I have to pay their school fees and all other things, including hospital bills for Abena. The situation really took a toll on me, and I couldn't even go to the market because I couldn't leave her alone at home.
When the journalist came to the community, I met him and I narrated all my story to him.
The plight of Abena and her family was brought to the attention of the Ministry of Sanitation in Ghana, thanks to a media report filed by Mr. Joseph Wemakor.
Hi, my name is Joseph Wemakor. I am a journalist, a UN Sustainable Development Goals advocate, a trained climate change proponent, a youth leader, and a global human rights activist.
23rd of June, we saw this publication by Joseph Wemakor, which was, we told is a human rights reporter. And we saw this dilemma of a 15-year typhoid patient. Now, you see, this is the message that we've been talking about, that if you don't have access to improved toilet facility, the consequences are far-reaching. And having typhoid is just a typical example of somebody who has taken on board somebody's feces. Now, having typhoid also means that there's the potential that such a person will be spreading the disease. And in an environment where the report indicates that they do not have access to toilet facility and open defecation happen to be the norm. Quickly, as a project, we thought that this is one area we should also quickly get into and then follow up to see how best we can help this 15-year-old person. So our interest is to take advantage of the report whilst we are helping the 15-year-old person trying to provide a toilet facility to stop the spread of the disease. We also take opportunity to educate the masses within that environment.
I happen to be a beneficiary of the Center for Science and Health Communication Training or Capacity Building Program of journalists.
The Center for Science and Health Communication was established in 2008 to help ensure that healthcare professionals, scientists, and media professionals can all communicate science and health issues so that members of the public would also understand. So one of our mandates is to provide training opportunities for media professionals, for scientists, and for researchers.
The center was privileged to receive some funding to train journalists in Ghana on COVID-19 reporting at the peak of the pandemic. With technical support from some faculty members at the School of Communication Studies, University of Ghana, and some senior journalists and editors, the center enhanced the skills of over 30 journalists who practice in Ghana.
Thanks to the National Research Foundation of South Africa and key funders who helped us, they also agreed that we could consider including some other infectious diseases. And so in the training, the focus wasn't only on COVID-19, but we were looking at COVID-19 and other infectious diseases.
And I must say that I benefited from this particular program. It has enhanced my knowledge, honed my skills, and I have been able to report accurately and effectively on issues of infectious diseases as far as health reporting is concerned.
Now that they've been able to help us build the toilet, I feel excited because we are no longer going to defecate outside, and it prevents my siblings or other people from having typhoid fever.
I'm very grateful to the journalist, Mr. Joseph. If not for his help, I wouldn't know what to do. He is truly God sent.
I want to say a big thank you to Joseph, the journalist, and the Ministry of Sanitation for coming to help me.
Journalists really have a great opportunity to make changes, to make positive changes in the lives of individuals and communities. And we do believe that, although we got to know about this, others that we didn't hear of, I'm sure also even individuals who watched them or read them or heard about them may have also led to some kind of changes that, of course, we haven't yet documented.
This report was made possible thanks to funding from the National Research Foundation of South Africa and technical assistance from the Center for Science and Health Communication, CSHC.